What are the top 6 reasons why you should not get that multifocal lens implant for your cataract surgery? If you are about to have cataract surgery, your eye doctor has likely reviewed with you many options for lens implants, including lenses that can help you see everywhere from far away to very close without glasses. These lenses are generally called multifocal IOLs or intraocular lenses. While these lenses are truly amazing, there are some limitations and may not be the best fit for everyone. When I plan out a cataract surgery, I do a very detailed assessment of the health of the eye, including everything from the front of the eye to the back of the eye. And I consider my patient's lifestyle and work demands when I make recommendations about which lens implant would be the best fit for them. My name is Marc Shomer. I'm a board-certified cataract surgeon. I've been performing cataract surgery with premium lenses for over 20 years. I teach everything from basic to advanced cataract surgery techniques at the Doheny Eye Institute at USC. I recently performed cataract surgery on an ER physician with macular degeneration, and he said he would pay anything for the best lens implant money could buy. However, due to his retinal condition, I recommended a monofocal lens which would work the best for his particular eye situation. He was ultimately very happy with his vision that improved as much as it did. Reason number 1, why you should not get that multifocal lens. The AAO, or the American Academy of Ophthalmology, says that you need to have an otherwise healthy eye aside from cataract to be a good candidate for the multifocal lens. Specifically, these lenses are generally not recommended for people with vision loss from glaucoma, macular degeneration, or other eye diseases. The clear window on the front of your eye, which is called the cornea, needs to have a very regular, round shape and a predictable shape without significant issues. If the pupil is too large or too small, this might be an additional factor. The health of the retina and optic nerve are critical. In addition, the areas of the brain involved in vision all have to be working very well. So what is a multifocal IOL? These are lenses placed in the eye during cataract surgery, which are designed to help you see with less dependence on glasses, meaning the clarity of objects from arm's length to far away are sharper without glasses compared to a standard lens implant. The multifocal lenses do this by splitting light into different focus zones, which can reduce the need for glasses. Clinical studies have shown that approximately 90% of people with multifocal lens implants in both eyes hardly ever wear glasses. These studies were done in healthy eyes. This means that patients with multifocal lens implants in both eyes can drive, see a computer screen, and read at arm's length without wearing glasses in 9 out of 10 patients. Reason number 2. If you expect to see through walls, then this lens may not meet your expectations. I have seen patients come to me having heard elsewhere that they would never need glasses again. While this is true that in the vast majority of patients, in clinical studies, if you have an otherwise healthy eye, approximately 90% of people do not wear glasses when they have the lenses implanted in both eyes. But that's not 100%. Nothing works better to the lens you were born with. Reason number 3. If you were born very nearsighted, there may be an extremely high expectation for seeing things very close to your eyes. This can magnify small objects very well, like a microscope. This super nearsight comes with a trade-off of needing glasses to see things at distance. These multifocal lenses can give excellent distance vision and the ability to see things at arm's length. The best part is that you can look up from a book and see clearly at distance without having to reach for glasses. This is an incredible range of vision. However, the multifocal lenses do not provide the microscope vision you may have been used to as a nearsighted individual. Reading glasses can still be used with a multifocal lens if they were needed to see something very tiny. Reason number 4. If you have very irregular astigmatism or possible cryo laser refractive surgery like LASIK or PRK, then these lenses may not work for you. Multifocal lenses do an excellent job of correcting most types of regular astigmatism. This type of astigmatism you could think of as a football where there's a point on each end, which is symmetrical. These lenses do not do a good job of correcting irregular astigmatism. Think of the shape of a teardrop. It's pointing on one end and round on the other end. These multifocal lenses do not provide good vision through these irregular corneas. Reason number 5, there may be some night vision issues. The multifocal lenses might give you some halo or glare at night. Imagine a headlight in the distance. There may be a ring of light around the headlight, which can be bothersome to some individuals. Many individuals with multifocal lenses are not bothered by this issue, but some can be. If you want to decrease your risk of any kind of abnormality of halo, glare, or night vision problems, and you don't mind wearing glasses, then the multifocal lenses may not be the best choice for you. In addition, there are types of multifocal lenses which may not work the best when it's very dimly lit. A monofocal lens might provide sharper vision at night or in poorly lit conditions. Reason number 6, the cost of the multifocal lens might be unaffordable. These lenses are not covered by insurance, and there is an added cost, which can be expensive. It's true that the vast majority of individuals with these lenses do not need glasses anymore, which can create a huge cost savings over someone's lifetime. If you ever feel uncomfortable or pressured during an eye doctor visit, that feeling matters. Any medical decision involving a surgery or added cost should be based on understanding, not urgency. You should feel free to ask questions, take time to think, and leave the visit feeling informed, not rushed. There is nothing wrong with asking for a second opinion if something doesn't feel right. A second opinion isn't a rejection of your doctor. It's a normal part of making an informed medical choice. The most important thing is that you understand your options, the benefits, and the limitations and the cost without pressure. For transparency in my practice, when premium lens implants are appropriate, the out-of-pocket cost is about $2,600 per eye. Good medical care should feel collaborative, transparent, and respectful. If you ever feel unsure, it's okay to pause and seek more information. In conclusion, when it comes to multifocal lens implants, the real question isn't whether they're good or bad. The question is whether they're right for your eyes, your lifestyle, and your expectations. These lenses can be remarkable in the right situation, but they're not a one-size-fits-all. Eye health, visual demands, night vision tolerance, prior eye surgery, and cost all matter. And sometimes choosing not to use a multifocal lens is what leads to the best possible outcomes. That's why cataract surgery should never feel rushed or transactional. You deserve time, clear explanations, and recommendations that are tailored specifically to you, not a brochure or a promise. If something doesn't feel right, it's okay to pause, it's okay to ask more questions, and it's always okay to seek a second opinion. That is exactly why I take such a detailed approach to cataract surgery planning. Every eye is different, and every patient's visual needs are different. I spend a significant amount of time evaluating the entire visual system from the front of the eye to the retina and the optic nerve. And I use the latest diagnostic technology to understand how each eye truly functions. Cataract surgery itself isn't just about removing a cloudy lens. It's about choosing the right lens in the right eye for the right person. That means considering eye health, prior surgeries, visual goals, your daily activities, and your work demands. By carefully customizing each lens implant to the individual and to the patient's lifestyle, we can maximize visual quality, reduce unnecessary trade-offs, and give patients the greatest possible freedom to how they see the world. This level of planning is what leads to the best possible outcomes, and it's why thoughtful, personalized care matters. If you find these videos helpful, please like and subscribe for more. Thank you for your time. I hope you gained some valuable information from this. Thank you.